I'm Dr. Broadworth, and today I'm going to go over an overuse injury called posterior tibialis tendinitis. And so with this injury, it's typically an overuse injury in a lot of people, such as runners, dancers, skaters, people who are on their feet quite a bit. And so how a lot of people, what they complain of with this injury is they have pain with running, they have pain with the push off and running, they'll have pain if they stand on one foot and try to do some heel raises on one foot, or even maybe both feet if it's really inflamed. And so with this muscle that's affected, and we're going to go over that real quick. So the posterior tibialis, where it is it's right here on the inside. It's a deep muscle in the calf. It's on the inside here. It attaches to the tibia, and as well as a small portion, there's a slip on the fibula here, and it goes down the inside of the calf or the shin, runs all the way down around the medial malleolus or ankle bone here, and it connects to the navicular, as well as a slip of it attaches to the medial cuneiform bone, which is a small bone in the foot. And the main function of this muscle is to help support and stabilize the arch of the foot throughout the stance phase of gait. So it helps to stabilize that arch. And with these people who are on their feet all day or running, are runners that are putting in extra miles, sometimes these can be overused, and that's where that muscle will get inflamed and irritated and cause some pain. So with this injury, I'm going to go over also some things that I typically do for treatment. So again, how to identify that? You're going to have pain on the inside of that shin bone there at that ankle. So your tibia is that inside shin bone. You'll have pain there, and that'll be tender to the touch. And a lot of times you're going to have pain with heel raises. If you stand on one leg and try to do a heel raise, that's a pretty good way to tell. And then, so one thing that I typically recommend for this type of patient is make sure that you're icing to help manage the pain and decrease any inflammation and swelling. What you're also going to want to make sure you're doing is you want to address any flexibility and ankle mobility or foot mobility deficits. So making sure that your stretching is going to be important, but it shouldn't, completely flare up your symptoms to stretch that. Now, consulting with a physical therapist is important because they can give you a customized program. And what I'm going over really are just some of the generalities and the basics of what's going on. So some of the general exercise I'll have a patient do are some ankle ABCs, spelling out the alphabet with their foot, making sure that only their foot and ankle is moving and not their knee or their hip. Some resistive band exercises, pulling in different directions, and then also some towel scrunches to work some of those foot intrinsics. So you can put a towel under the foot and then scrunching it with your toes, doing that for a couple minutes. So those are some basic ones. You can also do some seated arches where you have your foot flat and you're lifting the arch of the foot, keeping the big toe, the little toe, and the heel down. So those 3 points, making sure those are flat on the ground. So those are some pretty basic exercises that I'll typically prescribe. But again, I recommend consulting with a physical therapist to get a customized program that is specific for you. Now, one of the big factors too on top of these exercises is really making sure to look at everything that might be contributing to these symptoms and to this injury. So a lot of times what I'll do, especially with my runners, is make sure that these people are in the proper footwear. With runners, checking out their shoes, how old are the shoes or how many miles do they have on them. Those are all important factors. Now, in a recent patient I have, and in a lot of patients, I'll find that the runners are typically in a minimalist shoe, meaning there's a lot of bend and flexibility. So if I take my dress shoe here and see how I can bend it all over, there's not a lot of support in this dress shoe. We want to make sure that we're supporting the arch of that foot so we're not, again, we're able to help stabilize that arch, take some stress and strain off that posterior tibialis tendon. Because of that tendon, the reason we got that injury and it's inflamed is it's been overused. So we want to make sure we have good support there. And sometimes like an over-the-counter orthotic might be needed in addition to a new shoe. So that I would say is a big key factor to make sure that you are addressing and looking for. And you can typically go to a running shoe store and taking a look at their shoes, making sure that you try on the shoes and make sure that they're comfortable for you. You know, everyone's foot is different, and so no one brand or type of shoe necessarily, just because it works for one person doesn't necessarily mean it's going to work for another person. So you want to make sure it's comfortable for you and it works for you. So that is my advice there on posterior tibialis tendinitis, what a lot of people might call some shin splints or some calf pain there. I hope you found this helpful. If you have any questions, please leave them in the comments below, and I'm more than happy